It's the Beth Cahill Show. And now, here's Beth.
Good morning and welcome to the Beth Cahill Show. We have a lot to cover today. There are several things to get to. I want to get to unemployment numbers and what has come out this week. I want to get to several items that are going to be important and very key for small business owners. I also want to talk about a damning report that came out this week also regarding the Chinese government and whether or not they hid the true numbers of infected patients with COVID-19 at the start of all of this. So let's start with that report, right? The report came out this week, and basically, I want to get into the role that the Chinese government played in giving the world disinformation and how that disinformation may have affected where we are as a country right now. Every week for the past several weeks, I have given you numbers on where we as a country stand with infected people with COVID-19 and where the world stands. And each week, I said, if these numbers are to be believed, there was a reason for that. China has been from the start less than transparent about COVID-19. And a report that came out from the United States intelligence community this week confirmed that China lied to the world about the number of cases and deaths that they suffered from COVID-19. The reality is that long before the world learned about this, the outbreak in China was significant. Some outlets reporting it could have started as early as November. You heard that right, November. So the fact of the matter is the United States and the entire world lost valuable time to get in front of this because of fake numbers coming out of the Chinese government. And that's according to this intelligence report. This would not be the first time that China has misled the world about epidemics that have originated in their borders. They did the same thing with SARS. But based on the numbers, just based on the numbers alone, just think about this for a second. China is a country that has 1.4 billion people. So out of those 1.4 billion people, they are reporting that only 82,000 cases and 3,300 deaths happened in China. So take that, with another country. Take Italy, for example. If you're look at what's going on in other countries, and you take Italy, they have a population of 60 million. They have reported close to 14,000 deaths with 60 million people. So if China had a similar death rate just based on population, they would have had over 300,000 deaths, not the 3,300 that's being reported based on that model. Listen to Dr. Burke speak on this. I think she explains it, better than I can. Listen to her.
When you talk about could we have known something different? I think all of us, I was overseas when this happened in Africa. And I think when you looked at the China data originally and you said, oh, well, there's 80 million people or 20 million people in Wuhan and 80 million people in Hubei, and they come up with a number of 50,000, you start thinking of this more like SARS than you do this kind of global pandemic. I'll just be frank. That's when I looked at it, I was like, oh, well, this is not, if as close as those quarters are, So I think the medical community interpreted the Chinese data as that this was serious, but smaller than anyone expected, because I think probably we were missing significant amount of the data now that when we see what happened to Italy and we see what happened to Spain.
So she says significant amounts of data were missing. So the rest of the world depended on information from China in order to understand what was headed our way. But what we got was faulty and purposely misled information from China. Medical professionals were being told numbers that were incorrect, and therefore leading them to believe that the situation on the ground was much different than what was actually showing up at our borders. To put this in perspective, back in January, on January 14th exactly, 1 week before the first case showed up in the United States, right here in Seattle, the World Health Organization tweeted out that based on the Chinese health officials' data, that there was no clear evidence of human-to-human transmission. They tweeted that out on January 14th. I mean, come on. They knew this could be contracted human-to-human at that point. And giving us fake numbers and lying about how this disease was transmitted literally cost the world and the United States thousands of lives and will continue to cost thousands of lives. It has been reported by the Washington Post, by the Daily Mail, and several others that the numbers in China could be 15 to 40 times higher than what their government is reporting. The reason that this is important to get correct is because the rest of the world acts based on data and modeling. We literally shut down an entire economy. So has several other countries based on data and based on modeling. And if we didn't get that right, not only will it cost lives, but it's costing the livelihood of millions and millions of people. And as if that's not bad enough that as a world we are dependent on China for numbers, the fact that we're also dependent on them for medical supplies is the biggest irony yet. America has been sold out from politicians for decades. That is no new news. For decades, our politicians have shipped our jobs overseas, our manufacturing plants overseas, and now in the middle of the biggest health crisis we've seen, probably that I'll ever see in my lifetime, the medical equipment and the medicine that we need is being manufactured in China. This is not a far-right issue. This is not a left issue. This is not a middle of center issue. This is an everyone in America issue. Listen to the Democrat Governor Cuomo of New York State speak on just this.
It is the cruelest irony that this nation is now dependent on China for production of many of these products. Many of these products in the normal marketplace were being produced in China, and now you have everyone shopping China for PPE, gowns, ventilators. The gowns, the gloves are not complicated components to manufacture. The gowns are Tyvek or a paper material. If you are a manufacturer who can convert to make these products and make them quickly, they are not complicated products. The FDA lists the specifications for these products on their website. If you have the capacity to make these products, we will purchase them, and we will pay a premium, and we will pay to convert or transition your manufacturing facility to a facility that can do this. But we need it like now. You know, we're not talking about 2 months, 3 months, 4 months. We need these materials now. That's the stress. I understand that. But if you are in the garment manufacturing business, if you have machinery that can cut a pattern, you know, a coverall, you're not making a fashion-forward fitted garment, right? These are relatively straightforward components. So if you can do it, it's a business opportunity. It is a state need. It's a national need. Please contact us. We'll work with you. We'll work with you quickly. There'll be no bureaucracy, no red tape, and we'll finance. We're not asking for a favor from these businesses. We'll finance what you need in terms of transitioning, and we'll buy the product, and I will pay a premium because we need it. And this is a number for the Empire State Development Corporation, which is handling this task.
I mean, this is what we are up against right now. We also have an American company, 3M, who is in charge of producing medical grade masks, the N95 masks that everyone needs to get a hold of, they have been ordered by the Defense Production Act to produce and distribute those to American hospitals. That company is now being accused of distributing them to foreign companies rather than American. I mean, if this is true, that is criminal. There is a government official who, basically blew the whistle on this company this week because of his experience and what's happening in Florida. He says that he's asking 3M for masks because they're willing to purchase them, but that 3M is telling this government official that they have no masks to sell. Why do they have no masks to sell? Well, because their American distributors are selling them to foreign countries instead. Those countries are coming in with cash and they're coming in with a higher bid. And these American distributors, in the middle of a pandemic that our country and our health officials are on the front lines battling every single day, and they need these supplies. And according to this government official, 3M is not making them available. The idea that an American company would behave this way is disgusting. And if it's true, which after it's investigated, we will find out. And if it's true, they should be held accountable, as should any American company that is behaving that way. The president tweeted on Friday that 3M will pay big for what they are doing. And here's how the CEO of 3M, Mike Roman, responded.
3M is not doing all it can to fight price gouging and unauthorized reselling is absurd. The narrative that we are not doing everything we can to maximize delivery of respirators in our home country, nothing could be further from the truth. We are doing everything we can to maximize our efforts and to fight COVID-19 and to support the healthcare workers here at home in the U.S.
So this week, the president signed an order to crack down on this. It's supposed to be enforced by Customs and Border Patrol. But you know what? It hasn't happened soon enough. The shortage is serious. The United States has not stopped exporting these supplies to other countries. Much like other countries have stopped. Other countries have put a stop to these exports. And the United States continues, as we speak, to ship medical supplies that our hospitals need overseas. President Trump needs to put an end to that, and he needs to do it now. This is something that is supposedly in the works, and it's a story that I'm going to continue to follow because it needs to stop. But as of this moment, critical medical supplies are still being, again, exported to other countries when our hospitals and our doctors and our nurses need them so badly. And that is a shame. So we'll continue to follow that story, but that's where it sits now. And moving on to unemployment numbers, there have been 10 million Americans filed for unemployment in the past 2 weeks. I mean, this is a question that begs asking, how do we manage this as a country? How high is that number going to get? I mean, truthfully, what can we expect going forward with these unemployment numbers? If there's a little bit of hope to be seen out of this, and I will say that I do believe that this is different than in times past when our country has seen bad economic numbers, simply because, and only because, this one is self-imposed. Never before have we, by choice, shut down our economy. We're doing it to ourselves, and it's meant to be short-term for the safety of our citizens. Now, by no means am I minimizing the effects that this is having on people or on families. I am not downplaying this crisis in any way. There are many families that are experiencing financial difficulty. I've been hit hard with this. My own company has been hit hard with this. So again, no way am I minimizing this. And, besides just the economic hard turn that people are facing, the mental well-being as well. I mean, the stress and anxiety of bills piling up, not having a job or a steady income coming in, that can't be taken lightly. So I'm only meaning to give a little hope that once we open up this economy again and those stay-at-home orders can be lifted, I do believe that American companies are going to start to prosper again very, very quickly. I don't think that we're looking at years to get back to that economic prosperity that we were seeing, prior to this. So the Labor Department, though, this week issued new rules on paid leave. So hopefully that's going to give some Americans that work for small businesses the opportunity to go on paid leave rather than unemployment. So the bill that the president signed last week, it has, extensive relief that's far-reaching for people that are unemployed. But even beyond that, the incentives for small business owners to keep on payroll are actually, those incentives are really good. And I think that small business owners really need to take a look at that because they're meant to be used. So Steve Mnuchin at the task force briefing this week talked about this in good detail, and here's what he had to say.
When Jovita says people working around the clock, we had both teams working till 4 o'clock in the morning and start working again today. We've heard feedback from lenders, community banks, regional banks, and we spent the last 24 hours making this system even easier. So this will be up and running tomorrow. I encourage all small businesses that have 500 or fewer people, please contact your lenders. Any FDIC institution will be able to do this. Any credit union, existing SBA lenders, and fintech lenders. You get the money, you'll get it the same day. You use this to pay your workers. Please bring your workers back to work. If you've let them go, you have 8 weeks plus overhead. This is a very important program.
So there have been a lot of questions from, small businesses and small business owners about these incentives, right? And why should, a big one that comes up is whether it's a restaurant, whether it's retail, no matter what it is, a small business that's been hit by this, why should, say, a restaurant who has nobody coming in to eat, why should they keep their employees on when it's more beneficial for them and for their employees to lay them off? That was a question that was asked at the task force briefing this week, and it's a great question. The Treasury Secretary made it clear that the incentive is this. The incentive is that these are loans that turn into grants. So if you're a business owner and you hire your employees back or you keep them on the payroll, you'll get money for their medical if you keep them on a medical plan. You'll get money for your rent, for your electricity. This was designed to keep small businesses motivated to stay open. So when this is over, that they're basically ready to reopen without all of the other steps that would come with having laid everybody off. So the thing to remember with this is you can only get unemployment if you don't have a job, right? So unemployment is intended for the larger companies, maybe, mid-sized to larger companies. But for small businesses with under 500 employees, this stimulus is intended to keep them running at the highest capacity they can during this, shutdown, if you will. So really, there's 3 things that are going on here. There's the expanded unemployment benefits that are up to 39 weeks. 39 weeks. There is an extra $600 per week. That's an extra $600 per week. So like for New York, it would be $1,100, depending on what your state's unemployment already is. Add another $600 to that for 4 months. And then thirdly, you have the $1,200 checks going out. Or secondly, you have the $1,200 checks going out. And then the small business program that we were just talking about, where again, that's where the government is going to give money to small businesses to keep their employees working. So if you have a small business, go to the SBA website. They're going to tell you where to get that money that you need. They are processing loans starting on Friday. So as of yesterday, they're processing loans. And again, those are basically grants if you use them to keep your workers on. It's really, really important for small businesses to take advantage of this. They should apply for the Paycheck Protection Program. Contact your SBA lenders, your banks, your credit unions. But this is available. It's available now, so use it. And, I actually spoke with a client of mine this week who is a small business owner. And I was explaining this program to him, and his response was, that his company was, going to tough it out, that they were one of the more fortunate companies that are part of the essential business categories that were allowed to stay open, and, that he would not be asking money from the government. And the best way that I knew how to respond to that was what our labor secretary said this week and in one of the briefings, and that was that employers need to be ready, not lost in this process. Small businesses represent half of the GDP. So if we spend, $1 or $2 trillion to support the 10 or 11 trillion that is definitely a worthwhile cost. 1 to 2 trillion on this stimulus to, eventually have 10 or 11 trillion stay in the economy. That is worthwhile. And that is the mindset that small businesses need to have that are hesitant to get some relief money from the federal government. That money goes back into our economy, and that is what people need to understand. If employees can continue to get paid and small businesses can keep a positive cash flow, that money will go back into our economy. And while we're on the subject of the economy, I am tired of the people suggesting that the pure mention of the economy and how this is affecting it is short-sighted, or somehow it's morally inept to talk about the economy during a health crisis. That's a subject that has to be talked about. And talking about it doesn't mean the people discussing it care more about the stock market than people dying. That's honestly an insane argument to make. How long can this country stay on lockdown? It's a question that has to be asked. Was the way that we went about closing down this economy the best and most effective way to do it? Well, I don't know. Nobody really knows that. Health experts can't even tell you that. They can't tell you that whether we, issued a stay-at-home order for elderly or immunocompromised, they can't tell you if that would have ended in less death. Nobody knows the answer to that. So what we did was we shut the entire country down. We have 10 million people applying for unemployment right now. So don't tell me it's not a question that we need to ask. I imagine those 10 million people and growing would like to know. We have to be able to look at the models that are being presented to us and be able to ask the question, if what we see in these models is matching the response that we're doing as a country. Because it's not just economic harm that's being done. We have kids in abusive homes right now where their safest place to go was school and being around their teachers. These kids, and there are far more than you think that are stuck in homes with parents who may have already been physically or emotionally abusive. Now pair that with these same parents stressing about their bills, not having a job to go to. Who do you think is taking the brunt of that stress? There has been a spike in child abuse across the country as these children are being forced to shelter in place with their abusers. These questions are worth asking. You can argue that the public health crisis we face is a price worth paying, but please don't act like it's not a price at all. It is time the president puts together the same amount of task force that he has formed with medical experts. But now let's put together one that includes mental health experts, economic experts, because eventually COVID-19 will pass. Eventually we will all go back to work, and whether we are ready or not depends on how we act right now. We must protect our society, and that means protecting them from more than just COVID-19. That is it for me today, though. Thank you for tuning in. I will be back same time next week. Stay safe, and as always, we are in this together, and this too shall pass.
This has been the Beth Cahill Show. If you have any feedback for Beth or would like to suggest a future topic or guest for the show, email beth@thebethcahillshow.com. That's Beth at thebethcahill, spelled Cahill, show.com. Tune in again next Saturday morning at 9 for more of the Beth Cahill Show, right here on AM 1590. The Answer.